In today's video, we're going over diagnosing scaphoid fractures. My name is Dan Pope. I'm a cash-based physical therapist. I am a strength coach. I'm a personal trainer. I'm a meathead. I love all things fitness. On this channel, we go over how to make you a better coach and clinician. All right, so I work with a lot of people in fitness and strength sports. So that's CrossFit, that's Olympic weightlifting, that's powerlifting. So with the bench press, you're pressing weight with the wrist extended. When you're doing Olympic lifts, right? Snatch, wrist extended, radial deviation. Front rack, same thing, extended with load. In gymnastics movements, in CrossFit, there's a ton of handstand walking. Wrist pain is very, very common. So a lot of folks that come in with wrist pain. First thing you should do as a physical therapist when someone comes through the door is rule out any sort of medical red flags. And one of the big ones in the wrist is going to be the scaphoid bone. Because if you have a fracture, you miss it, you keep exercising, there's a chance that bone dies, and having a dead bone in your wrist is obviously not a good thing. So in today's video, we're going to go over several sensitive tests to rule out scaphoid fracture. And if you have a patient that has any of these positive special tests, just refer out to a physician to get some imaging before you continue with physical therapy. First test we have is for snuff box tenderness. So essentially, let's go ahead and put your hand out like this, and it's actually quite easy to see. You see you have two tendons right in this area here. They stick out, they're very prominent. The space right between the two is called your snuff box, right? What I'm trying to do, relax your hand for me here, Tommy, is I'm trying to sink down right in this area, right above the bones in the forearm, and I'm gonna feel for a bone here. If I move the hand back and forth, you'll feel the bone pop up into you. That's the scaphoid bone, and you press down on that. If that reproduces the patient's symptoms, that would be a positive test. Next test is a scaphoid tubercle tenderness test. So show me your snuff box again real quick for me, Tommy. There you go. So if I go in here and I find the snuff box, I press down, relax that arm for me, and I go back and forth, I can be pretty certain that I'm on the scaphoid here. If I trace the scaphoid around the outside and I keep feeling until I feel a bony prominence here, that would be the scaphoid tubercle, right? So snuff box, I'm palpating the scaphoid, and then over here I have the scaphoid tubercle. If I have tenderness to palpation right in this area, right, and it reproduces the patient's familiar symptoms, that would be a positive test. And the last test we have for the scaphoid is going to be a compression test, a long axis compression. So if I grab onto the thumb right through here, I'm stabilizing and I compress, what I'm doing is I am squishing the scaphoid bone right here. So if you grab the patient here and compress down and it reproduces the patient's familiar symptoms, that would be a positive test. So these tests are all very sensitive. And what that means is that if you have a negative test, you have a good chance that there's not going to be a fracture in this area, you can continue with your physical therapy treatment. Now, if you have a positive test, these tests are not very specific, so what you need to do is refer your patient to the physician for some imaging to try to figure out what's going on. In the study that I'm mentioning here, which we'll put a link in the show notes, essentially if all these tests are positive, then the specificity does go up, right? So you can kind of rule in that there may be a scaphoid fracture, right? I do have a very long lesson on the diagnosis and treatment of wrist pain in CrossFitters, powerlifters, Olympic weightlifters. If you guys want to learn more, I highly recommend that you check out that. I'll put a link right above our heads. You can click on that. And thank you very much for watching. I'll see you on the next one.